Today's NPTE quick hit, ACL tears. We'll go through what they are, how to spot them, and why the NPT is obsessed with knees that say we're retiring early. I'm Jimmy McKay, PT podcaster, former radio guy, and I explain the NPTE without turning your brain into oatmeal. If you're studying, hit subscribe so you don't miss the good stuff. Let's get into it. Here's what an ACL tear is. An ACL tear is your anterior cruciate ligament waving the white flag when the tibia decides to take off without permission. Or more visual, it's the knee's version of a failed trust fall. Signs and symptoms. Here's the NPTE pattern. Heard or felt a pop, or both. Immediate swelling within 1 to 2 hours. Non-contact pivot or deceleration. Instability or giving away, that giving away feeling, and difficulty bearing weight. Pop, fast swelling, plus the pivot equals the NPTE screaming ACL directly at you. Here's how you rule it in or out. The rule in favorites: Lachman, that's the GOAT. Anterior drawer or the pivot shift. Rule out clues: slow swelling, 24 to 48 hours. That leans towards meniscus. Posterior sag, dashboard injuries. That leans towards the PCL. And here's the NPTE trap to look out for. If swelling is delayed, it's not the ACL. Meniscus tears want their moment too. Here's how you treat it. The NPTE loves when you pick a treatment technique that involves early range of motion, quad activation, reduce swelling, restore gait, and progressive strengthening. The NPTE hates return to sport immediately and no strengthening needed. Anything that sounds like denial, don't answer it on the NPTE. All right, kids, buckle up for your mock NPTE question. Here goes. A 19-year-old soccer player reports a non-contact pivot with immediate swelling and a pop. Ding, ding, pay attention. Lachman test shows a soft end feel. What's the most likely diagnosis? Here are your choices. A meniscus tear. B, PCL sprain. C, ACL tear. Or D, MCL sprain. Pause for dramatic effect for your correct answer. And of course we have C, an ACL tear. It's an ACL episode. Of course we're going to have that. But here's why. Immediate swelling, pop, pivot, positive Lachman equals case closed, kids. This is the NPTE StudyCast. Everything you need to pass in under 3 minutes. Share this with your study group so everyone scores and knees stay strong.